This combination medication is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin belongs to a class of drugs known as expectorants, which work by thinning and loosening mucus in the airways to clear congestion and make breathing easier. Dextromethorphan belongs to a class of drugs known as cough suppressants and acts on a part of the brain to reduce the urge to cough. If you are self-treating with this medication, it is important to read the package instructions carefully before you start using this product to be sure it is right for you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking children's cough medication, it's important to follow the dosage instructions from your doctor or the product package. Make sure to drink plenty of fluids while taking this medication to help break up mucus and clear congestion. The dosage of this medication is based on age, medical condition, and response to treatment. It's crucial not to increase the dose or take the drug more often than directed. If you're using the liquid form, be sure to measure the dose accurately with a special measuring device. For powder packets, empty the entire contents onto the tongue and swallow. If you're taking the capsule form, swallow the capsule whole. It's important to use this medication properly to avoid serious harm. Do not increase your dose, take it more often, or use it for a longer time than directed. If your cough returns, or if it is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, it's important to consult with a doctor. These symptoms may be signs of a serious medical problem. If you believe you have a serious medical problem, seek medical help immediately. Some possible side effects of children's cough medication include dizziness, drowsiness, nausea, and vomiting. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication for your child, they have determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. While rare, a very serious allergic reaction to this medication can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice or report side effects to Health Canada at 1-866-234-2345. Before giving your child this medication, make sure to tell your doctor or pharmacist about any allergies your child may have to Guaifenesin or Dextromethorphan, or any other allergies they may have. This product may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. You should also inform your doctor or pharmacist about your child's medical history, especially if they have breathing problems like emphysema, chronic bronchitis, asthma, or a smoker's cough, as well as if they have a cough with blood or large amounts of mucus, or liver problems. This medication may make your child feel dizzy or drowsy, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until your child can do so safely. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if your child is using marijuana. If your child is on a liquid form of this medication, it may contain sugar and/or alcohol, so be cautious if your child has diabetes, liver disease, or any other condition that requires them to limit or avoid these substances in their diet. It's best to ask your doctor or pharmacist about using this product safely. Additionally, the liquid forms and powder packets of this medication may contain aspartame. If your child has phenylketonuria, PKU, or any other condition that requires them to restrict their intake of aspartame, it's important to consult your doctor or pharmacist about using this medication safely. Before your child has surgery, make sure to inform your doctor or dentist about all the products they use, including prescription drugs, non-prescription drugs, and herbal products. If your child is pregnant, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Lastly, it's not known if Guaifenesin or Dextromethorphan passes into breast milk, so it's best to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with children's cough medication. Always keep a list of all the products your child is using and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors with children's cough medication, as it may cause a serious and possibly fatal drug interaction. It's important to ask your doctor when to start or stop taking this medication, especially if your child is taking MAO inhibitors. Additionally, be cautious of interacting products such as rolapitant. Always check the labels of all medications to ensure your child is not taking more than one product containing Guaifenesin or Dextromethorphan. It's also important to note that Guaifenesin may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all of your child's doctors that they are using this medication. Remember to always follow your doctor's guidance and recommendations when it comes to your child's medication. If a child has overdosed and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to call 911. If the symptoms are less severe, it is still crucial to contact a poison control center immediately. U.S. residents can reach their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. If your doctor has prescribed children's cough medication for your child, it is important not to share it with others. It is important to keep all medical and lab appointments as recommended by your doctor. If a dose is missed, take it as soon as you remember. If it is close to the time of the next dose, skip the missed dose and take the next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to storing children's cough medication, it's important to keep it at room temperature away from light and moisture. Avoid storing it in the bathroom and make sure not to freeze the liquid forms. Different brands may have different storage needs, so always check the product package for specific instructions or ask your pharmacist for guidance. And remember to keep all medications out of reach of children and pets. When it comes to getting rid of expired or unused medication, it's important to do so properly. Instead of flushing it down the toilet or pouring it into a drain, consult your pharmacist or local waste disposal company for the best way to discard it. This helps to ensure the safety of your family and the environment. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.